Blood gas analysis, ABG. Arterial blood gas analysis is a medical test that measures the levels of oxygen, carbon dioxide, and other important parameters in a patient's blood. It's commonly used in critical care settings, such as intensive care units, ICUs, and emergency departments, to quickly assess a patient's respiratory and metabolic status. Blood gas analyzers typically use a small amount of arterial blood, which is collected by a healthcare provider using a needle inserted into an artery. The blood is then analyzed by the analyzer, which uses various sensors and electrodes to measure the levels of oxygen, carbon dioxide, pH, electrolytes, and other parameters. The results of a blood gas analysis can help healthcare providers make critical treatment decisions, such as adjusting a patient's mechanical ventilation or administering medications to correct imbalances in the blood. Blood gas analyzers are also used to monitor patients with chronic lung disease, such as COPD, and to assess the effectiveness of treatments like oxygen therapy. The utility of a blood gas analyzer is significant in clinical practice, especially in critical care settings. Let's discuss some of the key benefits and uses of a blood gas analyzer here in this video. Assessment of respiratory and metabolic status. A blood gas analyzer provides quick and accurate information about the levels of oxygen, carbon dioxide, and other parameters in a patient's blood. This information can help healthcare providers assess a patient's respiratory and metabolic status, and make critical treatment decisions. Monitoring of ventilation and oxygenation. Blood gas analyzers are often used to monitor patients who are receiving mechanical ventilation or supplemental oxygen. By measuring the levels of oxygen and carbon dioxide in the blood, healthcare providers can adjust ventilation and oxygenation parameters to optimize gas exchange and prevent complications. Diagnosis and management of acid-base disorders. Blood gas analyzers provide information about the pH and electrolyte levels in the blood, which can be used to diagnose and manage acid-base disorders. This information is critical for treating conditions such as metabolic acidosis, respiratory acidosis, and metabolic alkalosis. Blood gas analyzers can be used to evaluate respiratory function in patients with chronic lung disease, such as COPD. By measuring the levels of oxygen and carbon dioxide in the blood, healthcare providers can assess the effectiveness of treatments like oxygen therapy and make adjustments as needed. Overall, the utility of a blood gas analyzer is significant in critical care and other clinical settings. It provides quick and accurate information about a patient's respiratory and metabolic status, which can help healthcare providers make informed treatment decisions and optimize patient outcomes. The guidelines for using a blood gas analyzer may vary depending on the specific device and manufacturer. However, there are some general guidelines that healthcare providers should follow when using a blood gas analyzer. Patient preparation. Before collecting a blood sample, it's important to ensure that the patient is in a stable condition and that the blood sample is being taken from the appropriate location, usually an arterial site. Patients who are receiving supplemental oxygen should have their oxygen therapy paused or adjusted as needed before the blood sample is taken. For patient receiving ventilation therapy, should collect arterial blood sample 15 to 20 minutes after charging ventilator settings to get real status of patient's oxygenation level. Sample collection. The blood sample is typically collected by a trained healthcare provider using a needle inserted into an artery, usually the radial or femoral artery. The sample should be collected in a heparinized syringe to prevent clotting and ensure accurate test results. Air bubbles present in the blood sample collected in syringe should be removed immediately before sending for analysis. They may cause bias in blood gas value, especially PO2. The sample should be immediately placed on ice and transported to the blood gas analyzer for analysis. Blood gas analyzers should be calibrated regularly to ensure accurate test results. This involves checking the accuracy of the device using a control solution with known values before testing patient samples. When using a blood gas analyzer, it's important to follow the device's instructions for testing and ensure that the blood sample is properly loaded into the device. Most devices will provide results within a few minutes. Interpretation of results. The results of a blood gas analysis should be interpreted by a trained healthcare provider who is familiar with the reference ranges and clinical significance of the various parameters. Abnormal test results may indicate respiratory or metabolic dysfunction, acid-base disorders, or other medical conditions that require further evaluation and treatment. In addition to these guidelines, healthcare providers should follow standard infection control and safety protocols when collecting and handling blood samples, and ensure that the device is properly maintained and serviced according to the manufacturer's recommendations. A blood gas analyzer typically measures several parameters in a patient's blood sample. The essential parameters that are commonly measured include pH. pH is a measure of the acidity or alkalinity of the blood. Normal blood pH ranges from 7.35 to 7.45. Partial pressure of oxygen, PO2. PO2 measures the amount of oxygen dissolved in the blood. Normal PO2 ranges from 75 to 100 mm of mercury. Partial pressure of carbon dioxide, PCO2. PCO2 measures the amount of carbon dioxide dissolved in the blood. Normal PCO2 ranges from 35 to 45 mm of mercury. Bicarbonate, HCO3. Bicarbonate is a measure of the amount of bicarbonate ions in the blood, which is an important component of the body's acid-base balance. Normal HCO3 ranges from 22 to 28 millimoles per liter. Base excess, B. Base excess is a measure of the amount of acid or base in the blood, relative to a normal reference value. A negative B indicates acidosis, while a positive B indicates alkalosis. Oxygen saturation, SaO2. SaO2 measures the percentage of hemoglobin in the blood that is saturated with oxygen. Normal SaO2 ranges from 95% to 100%. Electrolytes. Blood gas analyzers may also measure electrolytes such as sodium, potassium, chloride and metabolites like glucose, lactate and creatinine, which are important for regulating fluid balance and nerve and muscle function. By measuring these parameters, a blood gas analyzer provides important information about a patient's respiratory and metabolic status, which can help healthcare providers make informed treatment decisions and monitor a patient's response to therapy. Thanks for watching.